Hi, my name is John Nahr. Hope you're doing well. If you're watching this video, likely you have a very big decision to make regarding the replacement of your aortic valve. Today is day 126 post-surgery, and I feel fantastic. I had a minimally invasive aortic valve replacement done on May 2nd, and I've documented my journey to help you in your journey, both prior to the surgery and post-surgery. You have a big decision to make. I know that when I watch testimonials of other people that had to make the same decision as I did, it really gave me the courage to go through with it, and I wouldn't be here if I didn't do it. So hopefully this helps you. My name's John, and enjoy the video. I hope it helps you in your journey. How you doing? My name's Jack Nahr. You're probably thinking, what's going through this guy's head? Well, it's really simple. Like many of you out there, you're going to be going in and have open heart surgery, either a full sternotomy or a minimally invasive sternotomy, or even the TAVR surgery. I recently found out that I need to have a minimally invasive sternotomy and a aortic valve replacement due to a congenital problem. I have a bicuspid valve that has hardened. They call it stenosis of the valve. Most folks are born with three flaps or leaflets on their valves. Unfortunately, in my case, mine was malformed and only had two. So with that said, I had a heart murmur, which was discovered in my late 40s, and I'd been monitoring it. I had missed my last echocardiogram in 2017, and was a little concerned, but I would get back to it. They said the area of my valve was good, and that the pressure going through the valve was in a safe zone. I got a phone call on December 24th, Christmas Eve, from my sister-in-law very late at night, and she had said that my brother, who's 19 years older than me, had passed away, and he was more like a father to me. He had a valve replaced in his late 50s, although I don't look like it. I am 54, 55 in September, but I feel like I'm 35, if you know what I mean. With that said, when I got in the call, I knew something was up, because my brother would never call me at 2 a.m. in the morning. And I found out that he had expired with a heart event, and he had other challenges, diabetes, a few other things, and it was very sad for our family, but it also made me realize I needed to get in the hospital, get another echocardiogram and stress test if appropriate. When I went in to Austin Heart, I knew something was up during the test when the person doing the work was very quiet. And she said, I asked her, so were they past the flying colors? And a little chit chat, and she had said, no, let the doctor talk to you. When I sat down, I was thinking, hey, I was going to get a rubber stamp, everything was going to go on smoothly with life. And the doctor said I was in the severe range, that the surface area and the opening of my aortic valve was only 0.79 centimeters squared. That had degraded from 2.4 centimeters squared only 2 years earlier. So a significant reduction overall in the size, and a significant increase in the pressure of the blood going across that valve. Very intense. I then kind of was taken aback, and being educated as an engineer, and I work in the high-tech industry, helping clients who are in duress. I always try to bring in the best, and I always bring in the best, make sure we have multiple opinions of what needs to be the corrective action going forward, and I apply that same technique to my health. I end up getting 3, and I repeat, one recommendation before you go on this journey is get at least 3 recommendations. It's very helpful. You'll get different views from different surgeons, and ultimately confirm the data also. Have them rerun the test. One set of the surgeons run the test, and another set's run it also. I went, my doctors here in Austin were outstanding, but I also, once again, I had to double check and ultimately triple check is what I'm suggesting, going on to West Houston, Herman Memorial, and as well as the Cleveland Clinic, in which they all said, Mr. Nahr, you need to get this done in the spring. You definitely may think you're asymptomatic, but we believe that you'll be seeing some serious challenges coming up within the next, and it ranged. One Cleveland Clinic was 4 to 6 months. You might start seeing issues. Another doctor mentioned, you could have a sudden death event. And my primary said, look, you really need to get it done in February, in the springtime, which I chose to. So, first tip I'm going to give you, when the message is delivered to you, go on out and get multiple opinions. Work with your medical provider and insurance companies to ensure that they're within your network too. Just a tip there. It was well worth it. I spent the time reading as much material as possible on the internet. But most importantly is the YouTube videos, which I'm sharing mine now. Really helped me gain the courage to move forward with this. It's very scary to understand that somebody's going to technically power off your heart and your lungs and route you to a heart-lung machine, and you're off the grid. So it is a big decision, but for long-term health reasons, clearly, if you're watching this video, likely you probably need to do it too. So validate the findings. Number 1, get at least 3 opinions, and study. There's a wealth of data on YouTube, a lot of other sources. You can, learn how to read the reports, which I did. I wasn't trying to become Dr. Jack House Nahr, but I want to be an informed patient. The next area that I really wanted to share with you that you need to focus on is your physical posture. I was told by the doctors, don't go out and become, a Navy SEAL working out every day. You couldn't do something. But I walk every night, probably an hour and a half to a mile and a half to 2 miles, each night. And I doubled down on that, trying to get out a couple times a day. I never smoked, which really helped me in my diagnosis. It's really just this congenital valve issue. All of my the reports came back, and all of my main coronary arteries are clean as a whistle. So thank the higher power for that one. But I do want you to just be sure, if you can cut back on things in terms of intake on food, things that are bad for you. I gave up my love of my life, which is black licorice and gummy bears. I used to eat them by the bags. It's just a vice I have. Was in a high-stress job environment. I just love snacking on that. I also gave up carbonated sodas, and the one thing I did try to give up was red vino. I enjoy a nice glass of red. So really, I started focusing on, instead of cutting it out completely, creating red wine spritzers, half mineral water, half red wine. A good German friend of mine turned me onto those. So I attenuated some of the bad things, eating poorly, but I do have vices. If you're from Detroit, if you notice behind me, you'll see Michigan State, Detroit Lions, Tigers. I'm a big Detroit fan and Spartan fan. And another thing at Detroit that we really enjoy is Verner's soda. Verner's. It's a ginger ale. I have one of those right now. Figuring if I'm going into surgery on May 2nd, I might as well at least have one last Verner's. So that said, second tip that I give you is, and I'm weaving a lot of other sub ideas to sharing with you. You can use them, take it or leave it. But for me, just cutting back in certain areas, in particular sugar. Processed sugar is horrible for you anyways. Probably the root of many of our illnesses. So, stay active if you're active. If you're not, and if you can do some walking and whatnot, and you're asymptomatic like me, it's fine. Just don't become a Navy SEAL. The third area was really the hardest, is the mental aspect. I was in a very high stress job at work, and responsibility for nearly 1,500 people, helping customers that are challenged in the computer industry. Burners is tasty. With that said, I did work with the company I work for, and the people. I reported to my general manager and explained to her what the situation was, and she was wonderful, giving me a lot of latitude. So for the last 3 weeks, I've really transitioned a lot of my workload, pretty much all of it, to a very capable individual who will do a great job, and I could focus on my health. What was great about that was, after the transition, when I came home, we took a couple short trips, one to a wonderful wedding, to see old friends. For the brain, you got to laugh. So, highly, any people that make you happy, pick up the phone and call them, or go visit them like we did for a wedding in Key Largo. It was wonderful. Friends I grew up with since I was in second grade, and we just had a ball. It was it really a lot of love, a lot of rehashing of old stories, which I'll delve into a few of those throughout this series. I will share videos. If you want to watch them, great. If not, jump to the next one. But with that said, wonderful experience, and I strongly recommend anybody who's going through this, really stay close to your loved ones. If you don't have a lot of loved ones, watch comedies, for God's sakes. Or, any of these skit shows, they're very, very funny. And just, look for positive things in life. And stop reading. I was a vivacious reader, all the way from the BBC, Al Jazeera, Fox News, CNN, Reuters. I read them all online. And I really think that the reduction in screen time, both on the work side and on the personal side of reading a lot of those articles, negative articles, nothing positive. It's tough to find a good positive articles in the news. So get your head mentally on straight. Get some rest. Have fun with your friends. Keep your mind on positive aspects of your life. And anybody who's negative or isn't part of your support system, just avoid them. That's probably the best advice I could give you. But really focus on the glass is half full, kind of like my Buc-ee's cup here. Half full, very tasty. Life has endless possibilities. Another part of the mental ability to relax your mind before going into the pre-op, which it's typically 2 days before the surgery, minus tomorrow morning. And they'll draw blood. They'll test me for MRSA, probably from cultures through my nose. They'll also clearly listen to my heart, run an echo, do a few other things just to double check to make sure nothing has changed since our last update. with the doctors. So tomorrow on April 30th, which is a few days ahead of the surgery, they'll give me soaps. They want to review all my medications. Want me to bring all my medications physically in there. They look at it, make sure, okay, keep taking this, don't take this. They're very clear on not taking aspirin, but take your advice from your, and that would be the day of the surgery. So tomorrow I have a 2.5 to 3 hour meeting at the hospital. As I said, blood test, review my medications, listen to my heart, possibly an echocardiogram, and possibly some other tests that they may have me do. In addition, in the afternoon, I'm going to go on out. I want to see where the cardio rehab facility is and take a tour of that. I want to understand what tools and what exercises they're going to want me to do. I know they have breathing exercises. We'll get more into that as I go through my journey. But overall, three things I just love to share with you. One is validate any data from any surgeon or doctor at least 3 times if it's serious. The more information, the better. If you're analytic like myself, you want to see all the data and make your own decision. Number 2 is start to get your physical health in alignment the best you can without exposing yourself to any sort of event. That's important. Eating right, reduce sugar to 0 if you can, cutting out alcohol. I mentioned I like red wine. I stuck with it a bit. I had some weddings to go to, but I stuck to my my spritzers, and I wasn't going overboard there. And then get ready mentally. Extract yourself from stressful aspects at work if you can. If you can't, maybe you can ask to be given responsibility for other areas where you can do things to help the company or the business without being under direct stress. I really try to eliminate all the stress. And number 2 really is the financial side. Make sure that that all the doctors that you're looking at are covered by your medical plan. Also, ensuring that you pay up. If in terms if you've got bills that are going to come due, I don't think the first few weeks after the surgery I'm going to be interested in really looking at financials or having to pay anybody. So I'm kind of paid up through the at least 4 to 5 weeks out after May 2nd. So we'll see how that plays out. Tomorrow we got a big day. It's kind of like the prep with the coach before the big game. So I'm looking forward to that, and also the tour of the cardiovascular rehab facility, which when they power you off or route you to a heart-lung device, your lungs, you're not going to be able to breathe like you did prior to the surgery. So there's some breathing exercises and tools that you use, as well as other things to get you up to speed. Up quickly is the goal, and get you moving. That's key. So this is the reason I said my name's actually John Nar, not Jack Nar. But at the wedding I was at, one of my friends said I looked a little bit like Jack Nicholson, or I acted like Jack Nicholson. So I figured the first video here give you a little bit of character. I may go in and out of character. There's probably be times throughout this whole 6 to 8 week journey that I'm not going to want to be talking to the screen, but I will, because I think I'll try to provide valuable information. I hope the 3 areas I shared with you in terms of validation of the diagnosis, secondarily, get into physical alignment and mental alignment prior to surgery. Don't go in stressing out, big meeting before, the one day before the surgery. I can tell you this, and I'm very honest on this. I'm nervous as but a cat shitting razor blades right now. Very nervous, and these videos are a little bit about self healing here. I also enjoyed watching a lot of folks on YouTube. It gave me courage. So hopefully this this series of videos gives someone, even if it's one person, the courage to go through it and come through the other side and be really back to where they like to be. That will be a win for me. So everybody, have a great evening. I'll give you an update tomorrow after my pre-op and the tour of the cardiovascular rehab facility here in Austin. Bye now. Okay, hello. It's episode 2. 2 days before the surgery, I'm going in for, as I mentioned, I got the pre-op. I've got to go in my, I've taken my meds today that I normally take, and they actually wanted me to bring in all of my meds. I've got a bag here full of them. Hope I don't get pulled over by the police. We'll share that with the doctor. They'll then instruct me on which meds I should take the day of the surgery. I'm clearly going to fast the night before and into the morning. But today's really the focus on blood tests, another echo, and also they'll be providing me with techniques for cleaning with antibacterial soap, which will start a couple days before the surgery. One tip going into the hospital, I learn it every time, is it's very cold in those hospitals. I like temperature a little warmer. Bring a jacket just in case. And then always got to have your support system with you. Always have your support system with you in these cases. There's my beautiful wife. That's Tina. She's the boss. She's in charge. So today's the pre-op for 2.5 hours, and then we'll go do a tour of the cardiac rehab center, which we most likely will be doing a lot of the heavy lifting after the surgery. Peace out. Okay, walking into Austin Heart Hospital, main entrance. That's my wife. She's the real boss, keeping me in charge here. So let's make sure that things go smoothly here at Austin Heart for the pre-operative procedures. We are moving forward. Once again, be comfortable, sweatpants and a warm jacket as they keep these things at icebox cold. Talk with you in a couple minutes. Hey, it's John again. We just checked in. You know you're legit when you get the wristband. Very important. One other item I forgot to share with y'all, and this is of the utmost financial importance. In addition to the pre-op and the tour of the rehab facility, you should have a living will, as well as all other legal documentation in place and signed and notarized. We're doing that late today. Just a tip from John. Okay, here in the pre-op, getting ready, 2 days away. Fortunately, only had to have 3 pinpricks. Make sure you hydrate. Drink a lot of water before coming in. No coffee before coming in when you're giving blood. It really helps quite a bit. My record was 6 pinpricks in the prior, and they had to bring in an ultrasound to get a vein. But they took 8 vials. A couple we sent off to the blood.
Because on the Avengers, there's a scene.
We're on the elevator going up to Dr. Corindi's office.
Avengers has
My
to
wife's
let
on a
go.
call right
When
now,
he
so
says, just let me
important.
go, it's okay.
I'm going to have the doctor fill
No,
out
but you don't know
my
who it
medical
is, so
release
it's fine.
form
But she just was
for
worried
work.
about you because
You got to
of
do that.
Thomas.
Typically called a MTR form. Don't forget to do that before surgery. Hey, this is the valve clinic where my doctor is located. Dr. Corindi, he's a pretty good guy. I'm going to give them the MTR form, the medical form that I then send into my work so they're aware. Piecing together a little bit of it. They got Michigan State colors here. Today has been good. Have gone through multiple. They took blood. They weighed me. 2 chest X-rays, and now I'm down here. I met with the breathing expert with the inspirational spirometer, the IS, for practicing before the surgery. More to come. Meeting with the anesthesiologist here in a bit. Well, we're pulling into the hospital here at Austin Heart. I'm going to put my faith in God and Dr. Karindi and the staff. And we'll go through the surgery. A little nervous. A lot of nervous. But it has to be done. Better now than later. I'll check in with y'all a little later, and once we come out of get into the ICU. By the way,
10 minutes.
now that we're early here at 6:20 a.m., got to meet at 6:30. Did the bacterial cleaning in the shower, and the best part of it is we got the best parking spot here at the hospital. Clearly not a lot of people here. First time. We'll catch up. Bye.
Go.
Okay. It is day 8 after the surgery from May 2nd. Heart valve replacement. I got a 20 millimeter bovine or pig valve put in. It's been a challenge. Key thing I can suggest, your best friend will be one of these pillows. Hug it, love it. When you sneeze, cough, get up, etc. Don't use any weight bearing. Other is the incentive spirometer. This thing is key and critical. I had 2 low points. One was after day 2 and 3, I got a little bit of pneumonia going. Expected when they shut you down and then bring air back in. Many of the outer layers of the lungs have to be re-stimulated. Secondarily ended up having a higher than expected heart rate, north of 100, around 125. They attributed to could have been 3 things: a urinary tract infection, which was discounted. Number 2 was a pneumonia, which I had a bit of, and then lastly is a pericardia inflammation. It's the sac around the heart, and they gave me some anti-inflammatories and painkillers, and I did a lot better last night. Going home today, very excited about it. You could look at the board over here. This board will become your lifeline. Has your nurse, your game plan, kind of shows who's on first, what meds you're on. I got off of the narcotic meds. They didn't mix with me. My body just can't handle it. I guess I'm glad they do. It doesn't. I continued to do my 4 walks a day. Approximately, I'd say they averaged about a city block long around the corridor. We'll go on that. And then you have yellow socks when you're a fall exposure, at least at this hospital. And when you earn the fact that you're not a fall exposure, you get blue socks. So I'm very proud of these blue socks. So God bless. I know that I've got much more of a journey, probably another 8 weeks of recovery and focus. Just one recommendation, it's a roller coaster. You're going to have great days, 2 steps forward, one step back. Happiest day of my life right now. Leaving the Austin Heart Hospital after the 8th day and gonna wave goodbye to that nice lady right there. And the weather's a nice cool 65 out, but to see the, smell the air and the sun shine, I'm just tickled pink. So more to come on my journey. Bye-bye. Well, it's day 60, post May 2nd surgery. I feel great. Walking about almost pretty much 4 miles a day. Just going through cardio rehab in parallel. Trying to eat right, but also put on a little bit of weight. Lost 15 pounds. Probably back up about 8. Just take your time through the recovery. I'm actually at Cedar Point, Ohio. Beautiful view in the background here. As far as your journey in terms of your heart repair, make sure you enjoy life. I'm definitely doing that. It's wonderful. It's utterly beautiful. So take care, everybody. This will be my last installment. Don't worry. It will all go smoothly in the end, and things will work out. Bye-bye.